Renfrewshire Technology Enabled Care is a keen supporter to help people within Renfrewshire who are at risk of falls. We work very closely with our res colleagues and the hospital to ensure that anybody that has a falls is reported on to their local falls team, and any assessments are then carried out to ensure that any falls that happen in the future are responded to quickly and effectively by our responder service. An example of the kind of care package that we can install with enhanced telecare is this sensor here. This is called a bed sensor, and it does exactly what it says. It lies across the top of the mattress of your bed and it works on your body weight lying on top of it. So at night when you go to bed, we tell this little box here to expect a time for you to be in bed. We also then program a time that allows you to get up and go to the bathroom during the night in an allocated time that suits yourself. Potentially that could be 15 minutes, it could be 35, it depends on your individual circumstances how long. It doesn't also mean that you can only make one trip to the bathroom in the evening. You could go 6 times in the evening as long as you did it within the time frame that the allocation has been put within the box. So if you want to get out of your bed during the night, as soon as you raise off your bed, this bed sensor will start working out the allocated time-lapse time. If you return within the allocated potential 15 minutes, say, and you lie on top of your mattress, the bed sensor knows that you're back in bed and you haven't fallen on the floor and you're safe and well. If you were to return out with that time, as soon as it's 15 minutes and 1 second, this would be sending a signal, again, through your alarm system to let the control centre know that there has been a bed on occupancy recorded. That call is then diverted to the responder team, who will come out to your house to make sure that you're not lying potentially on the floor. This is a great solution to help ensure that people that have falls during the night don't lie all night until the next morning whenever their carers or family members potentially come in. So it's a huge benefit to ensure that we get the emergency services in where necessary within a small time frame, potentially 15 minutes of you having your fall. This does for during the night, but what it can also do is it can be part of a 24-hour falls package. So in the morning, whenever you rise out of bed, we can also supply what's called a fall detector. Again, we've got 2 varieties. We've got a neck-worn fall detector and we've got a wrist-worn fall detector. The neck-worn fall detector, as we're around the neck, this is not waterproof, unlike your pendant. So just to point out that this will not go into the shower with you. Or you can have a wrist-worn fall detector. Now, depending on your level of need, what your potential falls risk is, the neck-worn fall detector remains quite static. They're very clever devices that work on the speed of your fall and also the temperature. So if you fall from here to the ground, it calculates the speed that you've had your fall, and it also works out the temperature from what it is here to what it is in the ground, and that is what sends your signal through. You don't have to press anything, but there is a function within the fall detector that if you have the understanding that you've had a fall but you are uninjured but you need help up, you can press the actual pendant. So it is potentially a pendant and a reporting of a fall within one device, and that's exactly the same for the wrist-worn fall detector. We find the wrist-worn fall detector is maybe for people that aren't as mobile, that potentially if you were to move out of your seat and have a fall, this would probably be the better device for you. But for the more mobile person, the neck-worn fall detector seems to work a lot better to allow you still to carry out your day-to-day functions, but knowing it's there. Potentially very good for people that have blackouts, seizures, epilepsy. These sensors will do that call for you without you having to press the pendant. So what you potentially have now is a 24-hour falls package that at any time you have a fall, the longest time that you will lie on the floor would be from your bed sensor. But rest assured, we would be out. Gone are the days, we're hoping, where people have that fall at 12 o'clock at night and lie for potentially 8 or 9 hours until their carer comes in the morning. One of the most important things that Renfrewshire Technology Enabled Care Service can do, along with providing the type of technology for people that are having falls within their home, is we can potentially get up any uninjured faller from the floor without having to involve the Scottish Ambulance Service. We use these Manger Elks where somebody has had a fall but is uninjured. We will only use these where we have confirmation from our service user that they have absolutely no pain. If you are suffering any pain, we will call on the emergency services to come out and assist and assess you. We do not take our service users' health lightly, and in any emergency, if we're required to get the emergency services, that would be our first port of call. But the savings that we have made and the collaborative working with the Scottish Ambulance Service by using these lifting cushions has been felt throughout Renfrewshire. By being able to help our service users up and back into their bed at night or off the floor during the day, the Scottish Ambulance Services are now able to answer the real-time emergency calls that requires their assistance.